Well, hey, good afternoon, everybody. Rolling into evening here. I just want to say this is Congressman Adam Kinzinger. Thank you for taking a little time. I really just wanted to reach out to everybody and talk a little bit about kind of the latest with COVID, talk about more in particular the vaccines, any questions about them, where we stand. And we have four very, very good guests that I'm going to introduce in a second. That will give a little bit of an introduction and then take your questions. So I want to just let you know that if you want to ask a question or you have a comment, you can hit *3 on your dial pad, and that'll get you into the process of asking a question. Again, that's *3. And I'll repeat that a few times here throughout the kind of intro portion, just because we're going to have more and more people join us as we go. But again, this is Congressman Adam Kinzinger, and I want to just give you guys a little bit of a rundown on where we are on vaccines, and then introduce our guests. So as of today, Illinois is administering an average of 103,000 vaccines per day. We estimate about 16.2% of the population in Illinois is fully vaccinated. Almost all the residents of the Veterans Home and the nursing homes in the 16th District have received at least one dose of the vaccine, and many are fully vaccinated. We know, though, that the demand for the vaccine is exceeding supply, so the state of Illinois and other states have prioritized the most vulnerable and the most exposed residents. If you all are familiar with the eligibilities, they're listed, but as of March 29th, it's opened up to restaurant staff, construction trade workers, religious leaders, and then the expectation is April 12th, any resident above 16 will be eligible for vaccination. I got my vaccination. I got the Pfizer back in December, and I'll tell you what, it was good to get it, and I think estimates today are over 90% effectiveness still for Pfizer and Moderna, and of course Johnson & Johnson is a one-shot regimen. So we have a lot to be frankly excited about in a tough time, which is this country really stepping to and finding this. But we have, again, if you want to ask a question, *3, this is Congressman Kinzinger, so *3 will get you in the queue. But I want to introduce our four guests today, and then just turn it over to them. They have some thoughts for you, and then they'll be happy to answer your questions. The first guest is Dr. Vishnu Chundi. He's the chairman of the COVID Task Force for Chicago Medical Society. Dr. Chundi is also a senior partner at the Metro Infectious Disease Consultants, which he joined in 1995, and is now the largest infectious disease practice in the United States. And he's witnessed two pandemics now, HIV and now the SARS-CoV-2. We have Dr. Kate Mullane from the University of Chicago. She's a professor in the Department of Medicine and section of infectious disease, and she's an expert in the diagnosis and treatment of infections in immunocompromised patients. She's active in the General Infectious Disease Clinic, and as the director of infectious disease clinical trials, she's currently investigating experimental agents for treating and preventing COVID-19. We have Dr. Edward Lin, who's a trustee of the Chicago Medical Society and co-chair of the COVID-19 Task Force. He's the former professor and interim chair of the Department of Obstetrics and Gynecology at Rush University Medical Center and Rush Medical College, and Dr. Daniel Johnson, a professor of pediatrics at the University of Chicago Medicine. He's board certified by the American Board of Pediatrics and pediatric infectious diseases. His clinical care focuses on inpatient and outpatient pediatric infectious diseases and is nationally recognized pediatric infectious disease specialist. So we're very lucky to have these four doctors with us today. They obviously, even reading their bios, I realize how much education they've been through and the hard work they do and how important they are to the community. So again, I'll say to everybody that hadn't heard yet, *3 if you want to ask a question. It's Congressman Kinzinger, and I'll turn it over now to Dr. Chundi. Dr. Chundi, thanks for being with us. Appreciate it.
Thank you for that kind introduction, and welcome everyone and taking the time out of your day to address this significant issue in our lives. So briefly, I just want to touch about what our group does. So our group is about 120 infectious disease doctors. We're in multiple states between Michigan, Illinois, Missouri, Georgia, Mississippi, Arizona. So we see a larger picture, we've taken care of 150,000 COVID-positive patients during this time. And what we've seen is this pandemic seems to get better and then it surges again, and we're in the midst of another surge. I was on call this weekend, and again, it was very, very busy in the hospitals, which has been, heartbreaking for a lot of us on the front lines who've watched so many people pass away alone in the hospital. And the beauty of what's happened is, as a country, we've shown how great we are as a science community, because we've come up with 3 fantastic vaccines. And if you poll all the infectious disease doctors out there, and you said if you could get a vaccine that's over 90% effective, 100% effective in preventing hospitalizations and death before, as this pandemic started, would you take it? And you would get 100% of the infectious disease world, clapping and cheering. And so one of the disturbing things that we've noticed is even our own medical personnel in our hospitals are hesitant to get this vaccine. They're worried that it was developed too quickly. They're worried that it is not safe, and they're worried about the long-term side effects to the baby, and they're worried about side effects to in pregnancy. The other issue is myself. I have a daughter who's immunocompromised, and it was very scary for me for the last year to come home knowing I've been seeing COVID patients and worried about infecting my daughter. Dr. Mullane is an expert in taking care of really sick patients who've had transplants, et cetera, so she's going to address that issue. I don't want to go on a soliloquy, but it's so important that we convince our loved ones and the people that are around us to take care of of the folks that we live with and the folks that we love, and do it for our society at large, and get vaccinated, because that is our way out of this. Wearing a mask, because that does prevent spread, and we've seen it in the hospitals where the safest places are actually the COVID units where everybody's wearing a mask, and then socially distancing to a degree until we're all vaccinated and the disease isn't at such a high prevalence. So I'll stop there and let Dr. Johnson give a brief introduction so we can leave as much time as possible for questions.
Thank you, Dr. Chundy, and thank you, everybody, for joining us, as well as thank you to Congressperson Kinzinger for inviting us on tonight. I'm very excited to be here talking about the vaccine. As you heard from the introduction, I'm a pediatric infectious disease specialist, and so my care focuses on the care of children. And I'll tell you, when I think about this vaccine, I first think about what a medical miracle it is that science was able to move so quickly to create this vaccine. But as a pediatrician, I'm very focused on safety. After all, children are probably the most important asset of our society, and it's very important that we keep them safe. And vaccines are a natural part of our ability to protect children, as we all know from the vaccines that they receive. And this vaccine, although created in record time, was still created with all the same safety features in place of any other vaccine that's been created to date. It was studied in a very large number of individuals. It went through the same processes that all vaccines go through, but it was done in record time because the dollars were there to make sure that it could be developed quickly, and there was confidence that if developed, it would be able to be used and find use in a very large percentage of the population. And that allowed them to be able to compress down the time it would have normally taken to move from step to step into being able to look at those steps simultaneously. So none of the safety was sacrificed, just time, so that way we could save lives. And really, it's not just a medical miracle, it's an economic miracle, because the only way in which we can open up our society fully is with vaccination. And if you look at the percentage of people within the healthcare field who have been vaccinated. At our hospital, the University of Chicago hospitals, we're over 70% of those that work at the hospital have been vaccinated, and we continue to see every day more and more people coming in to get vaccinated who are working there. And now, thankfully, we're able to vaccinate our patients, people living in the community, as a way to protect them, so that way we can see an end to this epidemic coming within sight. So I'll turn things over now to Dr. Mullane to introduce herself.
Hi, I'm Kate Mullane. I'm one of the infectious disease docs at University of Chicago, and I run the clinical trials office. I can reiterate what Dr. Johnson said as I ran the vaccine trial here for one of the mRNA vaccines, and there were absolutely no shortcuts taken in this trial. I've run many vaccine trials from influenza through pneumococcus and shingles, etc., and the rigor in which this trial was run was incredible. And 1,700 FDA employees went through every piece of data to make sure that everything was correct. Every I was dotted, every T was crossed when the FDA and the vaccine committee reviewed the data. So it's been an incredible journey to get the vaccines here. And the other thing I wanted to say was none of the vaccine platforms are actually new. The mRNA vaccine platform has been in development for over 20 years. And the Ad26, which is the Johnson & Johnson platform, was used in over 100,000 patients even before the vaccine trials started for COVID. So I want people to know that these are really not new vaccines, but certainly ones that have been studied. And especially with the mRNA vaccines, they were perfectly developed for pandemics like this, something that could be developed quickly and gotten to the public when needed. I'll turn it over to Dr. Lynn.
Thank you. Dr. Lynn, this is Congressman. Just a quick reminder again, star 3 if you want to ask a question, and I'll turn it over to Dr. Lynn.
Thank you very much, and I thank everybody, Congressman Kinzinger and the Chicago Medical Society for making this available. One of the big questions that is still circulating amongst healthcare professionals as well as the public is how do we deal with this vaccine in reproductive age women, those who are considering getting pregnant, those who are pregnant, and those who are breastfeeding. I think we have to just back up and realize that the COVID infection itself in pregnancy can have significant consequences. And unfortunately, pregnant women appear to be a little bit more vulnerable to the severe infection than non-pregnant women. But this also is something we see with things like influenza and pneumonia and other types of infectious disease. We do know from a small study that was done in Washington that women stand a significant risk of actually dying from the infection when you compare them to non-pregnant women. And we also know that women who develop the COVID infection during pregnancy have a greater risk of diabetes and preeclampsia, which is a hypertensive disorder in pregnancy, and premature delivery. Recent case report, this is a single case, that there was signs of an inflammatory condition in the baby of a mother that had COVID. So I think keeping that in mind, the American College of OBGYN and the Society for Maternal Fetal Medicine, these are organizations that provide leadership in my field of OBGYN. I have stated quite emphatically that women should not be denied the vaccine when they're pregnant. We are a little bit of a disadvantage because during the original trials from the safety trials that were done, there was no pregnant women that were enrolled. But as reported last week from the CDC, we now have just over 30,000 pregnant women that were vaccinated and reported to the CDC how they felt. And the real good news is that there was no pattern of any severe problems in the pregnant women who received the vaccine. Actually, they look very, very similar to non-pregnant women. And there were no increased incidents of miscarriage and things that really have people concerned. So we understand that women need to be free to make their own decision. And they really need to probably, have this discussion with their OB providers if they're pregnant. And things to consider is just, how much viral activity is in the community. We caught a break in the last few weeks when the viral activity in the Chicagoland area has decreased, and unfortunately, we're starting to see a little uptick. And I don't know whether this uptick is going to become another, peak of disease activity. But those are things you have to consider. And then you have to also consider, safety issues to the mom and to the baby, as we talked about. Similarly, the organizations and I currently concur that women who are breastfeeding should be offered the vaccine. Remember, this is not a virus that's being given to people that replicates in the body. This is not like some vaccines have live or attenuated virus. This is a magical vaccine that really is a biological exception in that the muscle cells that the vaccine is injected into get programmed in producing substances which trigger an immune response. So the body recognizes it as foreign, and makes antibodies, and lymphocyte cells become sensitized. And this appears to be beneficial. We also know that there's no reason to avoid getting vaccinated if you're trying to get pregnant or if you're having infertility treatment. I just want to put out there that there were a lot of rumors about the vaccine causing infertility, and that is not true. All the infertility experts have chimed in, and there's no evidence that it should cause infertility in males or females. So we're encouraging people just to live their lives, but most importantly, avoid the infection. Now, some other good news just came about. In January, there was a paper that showed that when women develop the infection, these antibodies that they develop will actually go across the placenta into the baby. And again, we don't know for certain, but it appears that may be protective and help the baby. We certainly see this in other diseases. And then recently there was a number of reports, both from Florida as well as a recent one that came out late last week from Boston, showing that the vaccination causes a tremendous immunologic response, much greater than the natural infection. And there is additional proof these antibodies will, transfer to the baby. And again, we hope this is beneficial, but as you can tell, a lot of things we're learning right now because we have so many women who have been vaccinated, and we're starting to look at them. And in general, I'm quite confident this is a great strategy to avoid a disease that can be quite harmful in pregnancy. So I thank you for your patience, and I'll be glad to answer questions when we get to that point. I turn it over to whoever moderating.
Yeah, hey, well, thank you to the four doctors. You guys are fantastic, and we'll go to questions now. We have a lot of questions in the queue. If you want to ask a question, *3. And by the way, if you don't get a chance to ask your question, at the end of this call, you'll be able to leave basically like a voicemail, and we'll get back to you. But thank you again to all our doctors, and now they'll answer your questions. And I think the first question we'll go to, I believe it's Dawn in Loves Park. Dawn, are you there?
Yes, I am.
Hey, go ahead.
I have a special needs child. He's 22. He lives with me. We have not been vaccinated and don't even know where our insurance or what can happen. But I am concerned for him. He is autistic, mentally retarded, and cerebral palsy. So we have a lot to deal with in my home. And we are very isolated. I mean, we grocery shop at 2 o'clock in the morning to avoid contact with anybody. And I don't know what to do.
Yeah. Well, Dawn, thank you. And, I think I'll just say first off, if you have any questions particularly about, kind of your rank in line there and getting in, you can call, your state legislator or call our office and we can help you with that. And quite honestly, the vaccine will not cost you out of pocket. But I'll turn it over to the doctors. And if you have anything to say on this, and by the way, I'll just quick programming note here. If you when you're done asking your question, I have to take you out of the queue, so you won't be able to necessarily respond. That's just how the system works. So, doctors, do any of you guys have anything to say on that?
Yeah, I think Dr. Johnson would he deals with children with autism, and so Dr. Johnson, do you want to take that?
Yeah, I'd be happy to respond. First, I admire the work that you're doing to try and keep yourself safe and keep your child safe by being careful who you're around. And I'm sure that you're appropriately distancing as well as wearing a mask and being very careful about hand hygiene. And vaccination is just one more tool that you can use to try and keep yourself safe. In fact, the state of Illinois made a decision that people who have children with special health care needs, like you've described, are moved to near the front of the line. Many are considered in the 1A group to be able to get vaccinated, because if you're not there for your son, then who's going to be? And so it's so important then that you get vaccinated in order to protect yourself, so that way you can be available to do the great work you're doing for your child. And now the state has moved towards vaccinating anybody 16 and above, depending on the availability of the vaccine. So I would definitely recommend that both you and your son receive the vaccine. Try and move that along as quickly as you can, so that way you're vaccinated. If you want to just go for the single dose, then the Johnson & Johnson, or what they will call also the Janssen vaccine, is one way to go. Alternatively, you can go for the 2-dose regimen with the Moderna or the Pfizer. And those are available to you, to both you and your son, so that way you can get the maximum protection that's available.
Excellent. Well, thank you. And I think another good point is, with some of the misinformation out there, there have been articles and discussions about the fact that some of our foreign adversaries have actually, in fact, tried to spread misinformation on the vaccine because they want people to be hesitant, and that would obviously keep the United States in a posture of, keeping the economy closed and be beneficial to foreign adversaries. So let's go next to Rockford and Sabrina. Are you there, Sabrina?
Yes.
Hey.
Yes, I'm here.
Yeah, you can go ahead. Go ahead with your question or thought you had. This is Adam. Go ahead.
Yes, my question was that I have asthma, and yes, I'm one of those people that are hesitant to take it because, I feel like the new strain that's out, they're saying that, there's a stronger strain, and I'm wondering, is the vaccine going to be able to deal with that as well? And what would it do? How would it affect me and my asthma?
Excellent. Well, that's a great question. I hope your asthma gets better. I know that's difficult. Let me turn it over to the doctors. And if you want to talk about that question, then specifically the strains we're hearing about, maybe and how the vaccine works.
Sure, Sabrina. Hi, Dr. Chundy. That's a great question. We see a lot of asthmatics in our practice, and clearly getting the natural infection with asthma is much worse than any side effect of the vaccine. Our group itself is given, I think, 30,000 plus vaccines, and most of the side effects are a little pain in the arm. You get chills and you don't feel well for a day or two. It really doesn't make anything a whole lot worse than that. The advantage of the two-dose vaccines as well as the Johnson & Johnson it's 100% effective against, I can't repeat this, it's 100% effective against preventing you from going into the hospital or dying. You may get a mild illness if you get infected, but these are unbelievably good vaccines. And now we're in the order of 85 million doses of vaccines being given out there. You don't see the side effects of, serious side effects except a handful of cases here and there. If you had 85 million infections, the death rate, we already have lost 550,000 people. I mean, it's unimaginable. And so you should get your vaccine as soon as possible. Anyone who's an asthmatic, anyone who has any pulmonary issues needs to be vaccinated as soon as possible. We'd be happy to answer any of the hesitant questions. A lot of these are one-on-one conversations, and we'd be happy to do that offline. So just reach out to us, and we'll be happy to talk to you.
Well, thank you. And, I think another good point about that, too, is just to reiterate what you said, it's 100% effective against fatality on this. And, even if you still get the virus, you think about it, if you had the vaccine, you've kind of given your body a jump start, and it's already, in essence, got troops at the door ready to fight for you. And particularly if you have asthma, I think it's very important. But thank you for that question. Next, we'll stay in Rockford and go over to David. David, how are you?
Yes, thanks for taking my call. I was let me preclude by saying I was surprised to get your call, an invitation to take part in this. As one who is a Democrat at heart, nevertheless, I'm just really been pleased that you, Mr. Kinzinger, have stood up to your former president.
Well, thank you.
My question relates to a group of which I'm a part, and that's a group of mostly older people who are cancer survivors. Healing Pathways Cancer Resource Center put this men's group together years ago. We met this past Saturday, as we do twice a month, and one of them surprised the devil out of us by saying his doctor informed him that he should not get the Moderna or Pfizer because it alters DNA or RNA, I forget what she said, and could have future results. None of us had heard this before and would have dismissed if he hadn't said that his doctor told him this. So I would very much appreciate hearing what the doctors on this call had to say.
Well, thank you, David. And I've heard that rumor as well, and so I'll pitch it over to the doctors.
Katie, you want to take this call? Dr. Mullane, do you want to take this call?
I would love to take this call. I would love to take this call. So messenger RNA is not the same as DNA. It cannot combine with your DNA. It cannot change your genetics. Messenger RNA is a very tiny piece of a genetic material that is part of the coronavirus's gene. And it specifically delivers the instructions to, if you remember back to high school, oh my gosh, the ribosomes that make proteins for us. It specifically gives the recipe of how to make that spike protein to our ribosomes. They make that spike protein. It then travels to the surface of our cells where our cells express it, and then our immune system says, hey, that's not human. I'm going to make antibodies to that, and I'm going to make an immune response to that. And when we make antibodies to it, we block that spike protein from hooking on to our cells, and so the virus can't infect us. Once that recipe is delivered, the messenger RNA is either broken down by enzymes called polymerases or just degrades. We cannot find any evidence of that messenger RNA left in our cells after about 70 hours. It's gone. And the way that the vaccine has to be delivered in these little lipid particles is because if we tried to give this messenger RNA without protecting it in that lipid particle, it would be destroyed immediately on entering your bloodstream. Your enzymes would eat it up. So none of the vaccines interact with or alter your DNA. They do not cause cancer. They do not cause birth defects, and they do not change fertility. So they're not experimental gene therapy. They're vaccines.
That's right. Thank you. And I think this. Oh, go ahead.
If I could just add on to that, DNA in our bodies sits in the nucleus of our cells. The messenger RNA can't even get into the nucleus. So it's not possible for the messenger RNA to even interact with our DNA. So there's no chance, whether you're an older person or a younger person, whether you've had cancer or not, there is no way in which the RNA can interact. And the previous caller asked a question about variants, and I just want to touch on this for a moment. That so far, of the 3 vaccines that are available in the U.S., there has no evidence yet that these variants can stand up to the vaccine. So at this point, the vaccines that are available in the U.S. treat whether it's the original virus or the variants that will work to successfully protect people from it. Just wanted to make sure that she got that full answer.
That's great. Thank you very much. Let's go to looks like we'll go to Roberta in McChesney Park. Roberta, are you there?
Yes, I am, Adam. Thank you for everything.
Hey.
Thanks for having me. Appreciate what you're doing for us.
Thank you. Thank you very much. You can go ahead with your question. Appreciate you.
I've had both shots, and I was happy with it. I did have a little side effects. My husband had more than I did, but it was slight temp for a couple of days. But it wasn't nothing, too serious anyway. Thank goodness. We'd rather do that than and then go through having the virus. But I was wondering, have they decided? I know they're talking about it. Where we have to have these every year then?
Yeah, thank you for your question. I'll turn it over to the doctor. Let me also say too, I got my vaccination, as I said at the beginning, and for a couple of days I had a bit of a temperature. It wasn't too bad, but it just proves that it actually works. It's actually a good thing to get, it shows that your body's on message. But I'll turn it over to the doctors on the annual question.
So Dr. Mullane is conducting, the one that conducts studies on this. So Dr. Mullane?
So the whole idea of variants is that RNA viruses like influenza, they mutate frequently. So we don't know how fast they will mutate once we get herd immunity. Influenza mutates rather quickly, and we believe that the SARS-CoV-2 virus mutates about 2 to 3 times slower than influenza does. The reason that we've seen so many cases of variants occurring is just because we have such a deluge of virus and a deluge of people who are infected. We know that there will be changes, and we expect that there will be boosters that are required. And in fact, boosters for some of the variants are already being developed. We don't know how often they will have to give. Will it be the same as every year with your flu shot? You'll get a new COVID shot. We don't know if that will happen or not, but we do believe that in the future we'll probably have to have boosters for the mutations that occur in the COVID virus itself.
Thank you very much. And next question, we'll go over to Rockford again to Carla. Hey, Carla, are you there?
Yes, I am.
Hey.
I want to echo the other callers and say that we Democrats respect what you've done a lot regarding the impeachment. And my question is about the Johnson & Johnson vaccine. My husband had that one, and it was a few weeks ago, and he was surprised when he got there because he thought he was getting one of the other ones, and then he remembered that he was very unsure about whether to take that one, but he said you're supposed to take whatever one you're offered, so he got it. In the meantime, you just hear so much about the other two, and I'm wondering if he can go ahead and get one of the other two, even though he's already had the Johnson & Johnson, just to relax his mind about it not having the numbers quite as high as the Pfizer and the Moderna, or is that just not at all allowed?
Well, thank you, Carla. I'll turn it over to whoever.
Yeah, Dr. Chundy here. So the answer to that is it doesn't matter which vaccine you get. The Johnson & Johnson, again, it was tested at a time when there were variants floating around, and it proved 100%, I can't reiterate this enough, I can't say this enough times, it was 100% effective against preventing hospitalization and death in South Africa, in areas where all these variants were floating around. So, he's got an excellent vaccine on board. He doesn't have to worry about getting a different vaccine. And it's just a testament to science and getting the vaccine in people's arms. But we started out slow with vaccination, but now, compared to the rest of the world, we're doing really well with vaccination. And we've got to get achievable immunity so the virus doesn't have many targets to go out and hit. It's basically... you get enough people vaccinated and the virus won't have anywhere to go, and hopefully it'll die off. And we got to get the whole world vaccinated because, you don't want somebody flying in from some other country and then reinfecting us with the resistant strain. So, this is truly a worldwide effort. So I'm glad your husband got vaccinated.
May I say something
Sure.
about this? When we started with the vaccine trials, we were hoping that we would have a vaccine efficacy of about 65%. When first Pfizer and then Moderna came up with a 95% vaccine efficacy, we and the world were astounded. The minimum we had hoped for was 50%, and our goal was 65%. Once you get up to about 80% vaccine efficacy, there's not really much of a difference. The curve flattens out and becomes very little difference between getting to herd immunity and keeping our population well once we get over 80%. So looking at how close these vaccines are in efficacy, no big deal. They're both very effective, and we're incredibly excited at how effective both the adenovirus and the messenger RNA vaccines are. It's really incredible.
Excellent. Well, we're going to take a couple.
Comments?
Yeah, please.
Thank you. I am very sensitive to the fact that the way things are reported in the newspapers and on the television media, I just want the public to understand that when you're looking at each of these vaccines, they were all studied independently. They weren't all lumped together. We call it head-to-head comparison. So when you hear these differences in percentages, you really you can't honestly compare them. You have to look at each one, and it's been emphasized. Each one has shown the same type of robust protection against severe disease and death, and that's why we're so confident. So don't fall into the concern that one has this number and one has another number, because they really are done differently, different populations, different countries, and that all can change the way the data comes out. Just one comment. That's all. Thank you.
Thank you. I'm going to take one more question, and then I'm going to take some of the questions that are out there that we won't have a chance to get to. I'm going to kind of combine them after this next question so that we can kind of get some quick answers for some people. Let me go. This is a question that a lot of people have, and so I'm going to go to James in Belvedere. How are you, James?
Oh, hello. How you doing?
I'm great, thanks.
Yeah, my question
James, you go ahead with your question.
Yeah, my question is, if we get vaccinated, we're not 90% of preventing. Why do we still got to wear a mask?
Hey, thank you, James. I'll let the doctors answer that one.
Dr. Johnson, do you want to, since we've done a lot of distance
Sure,
studies, do you want to take
very happy to do that, which is that, one day after there's enough people vaccinated, you won't have to wear a mask. But right now we don't have enough people vaccinated. And there's, as you indicate, the vaccine is 90% to 95% effective. And so that means then that there are some people who've been vaccinated who don't respond to the vaccine. And we don't have a good way of being able to say who did respond and who didn't respond. So until we get to herd immunity, we have to assume that there is still some chance that you could be a person who didn't respond. And therefore, you may run into somebody who has COVID and get sick. Once we get enough people vaccinated, the chance of you running into somebody who's got COVID gets so low that it's okay if you're not one of the people who responded to the vaccine, because you won't be exposed to COVID. So for right now, we've got somewhere around 20 to 25% of people vaccinated. When we get up to that 60 to 70% that Dr. Mullane was mentioning, then the need to wear a mask is going to go away, we hope, because of the herd immunity. But until then, you should be being cautious for your own safety and continue to wear a mask so that way you lessen the chance that if you didn't respond to the vaccine, that you won't get COVID. And this is important not only for you, but for your loved ones, your friends, your coworkers, because that mask will also protect them while they go through this transition period where we have people who haven't gotten vaccinated being such a large percentage of the population. Thanks for the question.
You. And,
it's a really good one.
Thank you. And I'll just say, too, I got my first Pfizer shot 5 days later. My wife came down with COVID, and I never got it. So you even right when you get the first shot, you get some effectiveness, but you just never know. And it's about just, running through the finish line tape here and being able to look back and mitigate as many deaths as we can. So what I'm going to do, I'm going to just combine a couple of quick questions. I'm just going to ask them because we're running out of time. But Marty from Rockford was wondering if there's going to be any vaccine that's nasal or otherwise, because he has a relative that's needle phobic. Somebody's asking, how do you convince somebody to get the vaccine without being combative? And then also Jackie in Rockford is saying her daughter had a bone marrow transplant, and is it safe for her to have the shot? So those are kind of three to wrap up. If somebody wants to take any of those, and I can remind you if you forget what the questions were.
Sure, I'll be happy to take the transplant patient one.
Okay.
For all immunocompromised patients, and we have so many different medications now that make people's immune systems quiet down for anything from psoriasis to colitis, et cetera, and then the big guns for things like a stem cell transplant. Those patients weren't included in the studies. However, we know that depending on where you are after your transplant, your immune system may or may not make an immune response to it. We know the vaccines are safe for people who are immunocompromised. The bigger question is going to be exactly how much of an immune response are they going to have. And there was a study that was just published a week ago that was done at Johns Hopkins that looked at their solid organ transplant patients. And after a single dose of a messenger RNA vaccine, only about 17% developed an immune response. So this is a thing that you'll have to discuss with the doctor that's taking care of you. We may look at how functional your lymphocytes are, but also at this point in time, we feel it's safer to give the vaccine than not to, because if you get any response at all, it's going to be better than nothing.
Thank you. And then we have the if there's anything else coming for somebody that's needle phobic, and also
there's
how do you
actually over 200 vaccines that are in development none of the ones that are for needle phobic people are on the front line yet, but there's some really interesting technology that's coming. University of Pittsburgh has sugar needles. They're very tiny that you put on the skin, and you dip the antigen onto those needles, place it on the skin, and it slowly goes in. There are some that are air guns, but I think that's for needle phobic people, no different than getting a needle. And at this point in time, we don't have any that are that I know of that are nasal ones that are coming forward.
And
let me ask. Go ahead.
Yeah, the needle is so tiny, and Adam, you've taken the shot, I've taken the shot, and it's such a small amount, you really don't even feel it. And they go, "Is it over?" So as long as you look away the other way and just kind of take a deep breath, I had a fair amount of needle phobic patients, and they were able to get through it. It's one of the easier vaccines I've taken. It's the following day when your immune system wakes up and goes, "Ooh, what was that?" that you feel it. But other than that, it's an easy vaccine to take.
Yeah, I
That's
can
great.
comment.
I agree. I didn't feel it. Go ahead.
Yeah, this is Edwin. I actually volunteer at a vaccination clinic, and we do have patients that are very concerned about that, and they have a history of fainting, and it's worked out really well because, as Dr. Chundy pointed out, this is a very narrow needle. It's very tiny, and most people aren't even aware they're getting it because it really is not associated with discomfort.
Excellent. Yeah, and I'll tell you, I didn't even feel it at all. And then so to wrap up, and again, everybody stay on the line if you didn't get a chance to ask your question, even if you weren't in the queue, because you'll be able to leave a message. But if you guys are talking to somebody that, maybe against vaccines or maybe skeptical, what do you recommend to people listening, how to convince them to get it without, being combative and turning it like everything into a political discussion or something like that?
Yeah.
So
I think you
Dr. Johnson
answer this.
Yeah, this is Dr. Johnson. I'm happy to
Go
answer
ahead,
that
Dr.
one.
Johnson.
Okay. So I think the key thing is listening more than anything else, is to ask them what it is that they're thinking about when it comes to the vaccine. So that way you can find out from them what it is that's got them concerned. And I think you need to acknowledge that concern because their concern is coming from the right place, I'm sure. They're thinking about the safety of themselves or of someone else in their lives. So acknowledge that it's okay to be concerned because it is something that they're hearing about for the first time or going to experience for the first time. And at the same time, though, you can talk with them about what your own experience was, if you've gotten it, or what the experience has been of others, and then try to tackle the question directly, which is, depending on what it is that they're worried about, to just talk about what feeling they're having and what is the information that could help them hear and understand more about the vaccine. Never tell them they're wrong, because they're not. It's how they're feeling. So they're not wrong in how they're feeling. They just need more information. And so it's really about saying to them, well, that's what you heard, but here's what I'm hearing. And then go through the information that you know about the value of the vaccine.
Right.
Yeah, I would just like to reiterate that telling people they're wrong doesn't help. It's to carry on the conversation.
Yeah, in my business, I've learned that pretty easy. Yeah, go ahead.
Well, I think this is really in the area of OB where we are making recommendations, and we realize that we may not have all the answers yet. And so I think it's critical that we listen to the patient and take the opportunity to try to educate them a little bit on what we do know, and try to help them understand when there is information out there that may in fact be misinterpreted or possibly wrong. But absolutely, don't try to argue with somebody and try to make them feel less knowledgeable, because I'm sure they've given a lot of thought to it. And I think we just have to work through it and be understanding of their position.
Yeah, and I've learned that when you start arguing with somebody and telling them they're wrong, it just entrenches them in what they already believe. So, look, to all the doctors, I want to say particularly thank you for your hard work during this. You were on the front lines of a pretty nasty fight that we've had, and we're coming out the other end because of your hard work. To everybody, so thank you for your hard work, and thanks for being on the front lines, and appreciate you a lot. And to everybody on the call, look, stay on the line. You'll be able to, again, like I said, leave a message and with any of your questions and things. And I know somebody was asking on here if the vaccine is going to be mandatory. Likely not, because even the military, I have to take the flu shot every year and get shot with all kinds of vaccines when you join, but they haven't made it mandatory. But I do encourage you to get it. It's an amazing miracle that this country and science and medicine has been able to produce, and it's something we should be very proud of. But again, to the doctors, thank you so much for your hard work, and to everybody on the call, thank you. God bless you, and be safe and be healthy out there. Take care.
Thank you.
Thank you.
Thank you.